We have a lot of patients who come in with spinal fusions, or really where they have hardware somewhere in their spine. And a question we get all the time is, can they still receive chiropractic care? And the answer is overwhelmingly yes, although we do change our techniques just a bit. So Lori here has scoliosis, and when she was 14, she had the Harrington Rod surgery. So we have a rod from her upper lumbar spine to her upper thoracic spine, meaning it's very rigid. And we can't do big manual adjustments in those areas. However, the muscles on the sides of the spine that support the spine are tender and tense, and we want to make sure that those joints, although they are not freely movable, still get stimulated so they can stay healthy. So we're just going to show you how we do some of those things here in the office. And then again, the spots that are freely movable, we're going to adjust them as normal, which that's going to be the neck, the lowest of her lower back, as well as the pelvis here. Because if we get a lot of spasms or a lot of tension side to side, that's going to make us a little more symptomatic, deal with more pain. So we're going to come through here. And again, this is where we have the fusion, and we can still do very light input to these areas to still get force application to the joint to improve movement, but mainly to improve stimulation. If we don't get stimulation, one of the real simple analogies for that is once we retire, a lot of people's brains stop to work as well because we're not doing as much on a regular basis. We're not stimulating as much. Same thing with the spine. If we're not getting movement, which is stimulation, which creates life, that area is going to break down faster than it should. So we're going to go through the main areas of tension, Lori's spine here. Take a deep breath here. We're going to run the rib cage on the left side, which is a super common thing with scoliosis. If you have rib pain, you do want to get checked out to make sure that it is not scoliosis causing that problem. That's going to affect our lung capacity, ability to breathe, get oxygen in, which again, that's going to be a longevity factor for us. And then all the way at the very top of the spine. Give me 2 more breaths here. Good. And so you'll notice even with a rod in there, we still have movement. Nothing's completely stuck. So we want to make sure that we allow that area to be as healthy as possible. And she's been getting adjusted for 45 years now. Yeah. And that's allowed her to be pretty pain-free and very functional over time, whereas a lot of people who don't get regular work on their spine that have those similar issues, they don't do quite as well as Lori, which is a bummer, but we can help people with that. We're going to come to the top of the neck here. C2. Good. Awesome. So that's just showing again how we can give a lot of input and really work on the spine and adjust the spine without doing the typical techniques that many people think about when they think of chiropractic. The upper cervical spine is going to play a big role with our sleep, blood pressure, heart rate. So our energy levels are huge. We're going to be right at C1 up top. Good. Right through. We'll take a deep breath in, and we're just going to do a little bit of cranial work up top. Let's do 3 breaths here. A lot of patients that have fusion in their vertebra, and we work above and below, and we actually still work on those vertebrae just in different ways so that we can help people get the best results possible, help them with any neuropathies they're dealing with, sciatic type pains, and really posture. Because when we get an area that gets fused, everything above and below breaks down way faster than it needs to, and it usually leads to more surgery, right? Most people who get a spinal surgery have another one, so we want to make sure people can avoid those. So if you have fusions or you're worried about things like that, we can answer a lot of questions for you and still provide great quality chiropractic care without actually irritating those areas.